Yeah, hi, good evening, dear students, parents, our viewers who are joining us today for another live session with Rus Education. Students, today is a very important topic about, you can say, the best medical university of Russia for Indian students. Yes, none other than Orenburg State Medical University. So please, if you have not yet subscribed to our channel, kindly do so. Don't forget to press the bell icon and please share this video with all your friends, colleagues who want to study MBBS, who are preparing for their NEET exam. Today, joining me in this live session today is Air Marshal Dr. Pavan Kapoor, who is the Vice Chairman of Rus Education, and Professor Anton Olegovich, the handsome, charismatic Dean for International Students of Orenburg State Medical University. So I welcome you both, and I request Air Marshal Dr. Pavan Kapoor, sir, to please go ahead with this session. And for all the students, I would like to request you, if you have any questions, any doubts, anything you want to ask the Dean or Air Marshal Dr. Pavan Kapoor, sir, you are free. Please write to us in the question and answer section or in the chat section. And for the viewers on YouTube, please use the comment section. So, Dr. Pavan Kapoor, I request you to please take over the session. Sir, please.
Thank you, Dr. Dinesh. Greetings and good evening to all the viewers today and all the students and parents. Today we have a very important thing. We all keep saying that Orenburg State Medical University is one of the best universities in Russia for Indian students to go to. We give you statistics. We tell you many things. But sometimes, it is better to know from the person who is at the helm of affairs, who knows the true situation and the true value of education in Orenburg State Medical University. And that person is none other than Professor Anton, who is the Dean Faculty, Foreign Faculty and for International Students. He is been very kind enough and magnanimous enough to be coming here week after week to address you all, to make you aware of what are your opportunities, both for academics as well as for extracurricular and other activities. And by activities, I mean good activities. Okay, don't take me wrong. There are many activities that may not be so good, but for all those activities, what all can Orenburg do for you? And Orenburg State Medical University, when everybody keeps saying that it is one of the best universities to go to, you might feel that how can I sitting in India talk like this? So it is better to know from the person who is running the helm of affairs at Orenburg State Medical University. So thank you very much, Professor, for being here with us once again. And I am sure you will enlighten our students and our viewers as to why Orenburg State Medical University is one of the best universities for Indian students to seek admission and get their much coveted degree from this university. So over to you, and I am sure all the participants will be today enlightened about the very essential and good features about Orenburg State Medical University. Thank you very much.
Thank you, Dr. Pavan. Thank you, Dr. Dinesh. Okay, let's start. Our educational fair is going on, and today I will show you presentation about our university with topic that we are the top choice for studying MBBS in Russia, and why we are top. I will show you. First of all, I need to tell about living conditions and mess, because we make accommodation of students in the hostel of Orenburg State Medical University is dividing into female and male blocks. We have two big 9-floor buildings for students of foreign faculty. Upon arrival, we make all meetings with all instructions. And this is like in army. After you got an instruction, you will be calm, because you know what you can do, what you can't do, how you need to do this, where you can get help, and etc. That's why all instructions our students getting upon arrival 1, 2, 3 days maximally. And after this, they divide into groups, start working with tutors of Russian language department. This is teachers of this department. That's why all of the childs are under the viewing of these tutors, these women who are trying to help the students, and their connection between student and faculty. My office from the starting. Since 2017, we made English courses for our teachers, and level of our teachers in English is very good. This is one of the buildings. I showed it was big restoration of this building, which was performed specially for Indian students together with Rus Education. That's why students right now live in very good conditions with separate bus, toilet, and so on. They can choose even room which they want. They have their own mess on the 9th floor with Indian cookers. That's why I think that this is very good. They live together. This is small, like small area inside the Orenburg area with the soul of India. No, this is one of the floors. This building is near big mall. You can see exterior face of this mall. Here it is. From this left side, this building is situated. And this is another very good thing. This is biggest mall in our city. Many food malls, clothes malls, and so on. That's why it's easy to student at the time of accommodation in our city to find everything that they need. Next very good thing, that on the right side, this is something near 700 meters between this hostel. We have our campus of University Educational Campus, where mostly situated departments of first year. That's why many classes, students of first year and even second, have near place of their living. This is another very good, I think very great opportunity for our students. Here I show you, this is 9th floor. This is graduate students of last year. This is our tradition to make signing ceremony one day before or one day after graduation. And even students of upper courses, they can come to this mess and make some meetings if they want. Social activities. Of course, this is a very big and needful part of living of faculty. I think without this, it's impossible that students will be part of our culture and we will be part of life of students, because really 6 years of their lives they will spend here in our country, in our city. That's why we try to make this connection. And each year we make annual festivals, excluding years of COVID. I will tell you truly, I think you will understand me why. But at last year we made convocation, graduation of students in normal regime, not as it was in first year of COVID. We made full convocation ceremony with all points which we made before COVID. I speak about photographic session, about video session, about translation of everything in YouTube and so on. We celebrate Republic Day. When we can, we celebrate Republic Day, and we celebrate it from 2017. And I can tell you that your young citizens, your childs are very patriotic, and this is very good because it's written on their faces when hymn of your country they hear, their faces are shining. We make days of Indian culture in our university, and this is very interesting days when our students educate our teachers and other students, citizens, with culture of India. This is, of course, master classes of Indian musical culture, clothes, and so on. Participation in different conferences and different activities. This is topical issues of modern philology, and our students participate in it. You can see this is students of 6th year, some of them, and 5th year. We made a scientific and practical summer university for foreigners from different countries, and students of my faculty, Indian citizens, they was as tutors in this summer university, and you can see that it was interesting not only for everyone who came, but it was interesting to them too. Days of peoples in our city. This is, as I told, mixing of culture. I showed this on last session 1 week ago. This is in our city library. You can see that it's interesting to our students to look into our books, and they present books not only on Russian but on English too. Museum of Cosmonautics, of course, so all students will come there, as they will make some work on cosmonautic topics, even on Russian language department at the days of celebrating of Cosmonautic Day. And of course, sport, because without sport, it's impossible to be healthy. That's why we make a real focus on sport. And I can tell you that 2 years already, we give permission to students, even of 1st year, to be engaged in skiing. And you can see, we are winter country, you know about this, that this sport activity is closed even to students from India. But what is phenomenal this year, this is Festival of Sport, which we made. From year to year, we saw that we have students who are really good in different sport activities. And we decided to make real festival where we can make different commons, and it will be real competition. And we made by badminton, football, volleyball, and of course cricket. First of all, we made a cricket tournament in our league, Orenburg League. This is through our students who studied on my faculty. And after this, I will show you our team travel to another city, to Ufa, where they participate in a cricket tournament all over Russia, to which different teams from different universities in which Indian students studied came. This is badminton. You can see boys and girls, they participate, and they got good results in it. Football, 2 periods of football was one at winter, second one at summer. Volleyball, of course, you can see amount of students who played and participated in it. This is very good. For me, this is very good that really Indian students became a part of sport life of university. And this is cricket team. I can tell you our cricket team took first place in the all over Russia competition that was held in Ufa city, in Ufa University. This is our convocation. I will show you 3 different convocations. Soon, after a few days, we will make 4th convocation in the life or in the history of the faculty. This is first. Second, this is time of COVID, but even at this time, we made some special zone for photography session for students because some memorial things they must have. And we have our territory of university where we can make. And we made this for students. This is last year. Everything was same as each year. You can see all students, all graduates on one stand together with rector of our university, Igor Vasilyevich. This is me. And all happy doctors which got their diplomas of government type from our university. Medical help. This is another thing which we truly made, that students in our city can get real medical help. All foreign students have to have the opportunity to receive medical care in the university medical clinic. We have our clinic. We have a separate doctor for students of my faculty. This is English speaker. And they can directly come to him and get consultation or even medical help which they need. And we made big work with our hospitals. Right now, they know how to work with foreigners. I mean, with Indians who came to our city. They phone to us. They tell needful information which by deontology they can tell us. A few days ago, I faced this situation when some clinic phoned to me. They told, we have your student. This is a problem in this field. But student told that he don't want to tell full information about his health condition to administration. That's why we will treat him. When everything will be all right, he will come back to the hostel. Okay, this is decision of student, but each time when something has happened, we know that some student under medical treatment or need even help from administration of university. Big part. This is education. And main thing for you, the training is conducted using the intermediary language English for 6 years of study, including all clinical departments. This is main thing which you want, and we really can give this thing. Since 2017, as I already showed to you, English courses have been organized for teachers of our university. More than 120 university employees have been trained during these years, and right now we made program that each 3 years we will make rotation of teachers for education for English in different levels. For students, we have educational books on English, of course, by different subjects. We perform academic mobility of teachers of FMG from India by different subjects. Here, this is microbiology. Here you can see this is clinical medicine, and here is physiology for different courses, of course. At the same time, this is 2020. Yeah, 1 month before starting of spreading of COVID situation, we held these cycles of lectures from the FMG teachers from India. Right now, we made decision that in September, October, we will return these courses because situation right now is not bad, and we can make prolongation and coming back of education of FMG. And here in 19, Dr. Shutosh with cycle of pathology, and Dr. Yedav Dinesh with cycle of pharmacology for students of different courses. Education is education, but medicine, this is near science. And we're glad that our students understood this and they try to participate in scientific activity of our university. And 2 years ago, we made first time in our history separate route of scientific society and in conference of the scientific society, especially for clinical departments of our university. And our students show their scientific works, and you can see that even parents or small members of families looked how their brothers or sisters present their scientific works. And this year, same, we saved this route of scientific society because it's very good in the work, and students liked it, and it's saved, and I believe that it will be for all the history of the faculty. Industrial practice. We signed contract with Max super specialty hospitals. This is big web in your country. You know better than me how many hospitals you have in different cities. I know that this is 14 different cities, and I know that right now Max maybe already they signed this contract with some another private route, and they will be one big clinic together. That's why number of clinics is increased very big. And our students, if it's needful to pass practice in India, they can make this practice in Max super specialty institution. This is our coming to the clinic. You can see this is vice chief by clinical work of this hospital, and chief of simulation center. Of course, results of students you need to see. Red diplomas in our country, this is highest result in education, in higher educational institution. And each year we have students with red diplomas. It means the students showed so big middle rating that they are best. Everyone can understand this, and they get a red diploma. It means that they got by all subjects mostly excellent in our university. Imagine that your child can, and each year we see this in community of Indian students. Yes, these 2 years level of red diplomas little less, but really you can understand that studying in online format for students is not good. Yes, we gave this education. Yes, we tried to made our best because it's needful for students not to stop education, but to concentrate them in online education is really hard. And COVID by itself made some walls between student and education. But as you can see, we have red diplomas, and you can understand that we performed needful things to maximally decrease this effect of year of education in online format. This is all the students. I want to show you their names because they are in history of faculty, and you can see what ratings, maximally 5.0, and some of them 4.96, 4.88, 92, very big amount. That's why this is very good students, and I can tell that many other students near this rating, but rating is not enough for a red diploma. At this year, I can tell you from all students who passed government examination, this is 139, 20 students passed for excellent mark government examination, and from them 15 students their rating near rating of red diploma. Little less, but near. That's why this is amount of very good students whom we have. And last thing by education, which I will show you, this is accreditation exam, FMG. The students will pass in India. Our university showed a worse result among all Russian higher education institutions, which range from 30% or more. You know that mostly, if we will look 3, 4, 5 years ago to statistic, each one will tell you that mostly graduates from Russian Federation, from China, and some other countries, they pass in amount 5% up to 12. And 12, this is very good amount. You can see that we passed up from this line. Our rating through all the years is more than 30. But as I showed previously, only those who applied and passed the exam were taken into account. Now we have calculated the percentage of all graduates of all years. For example, 4 years ago, he graduated. This year is graduated, students. What right now? What amount of students from all who graduated passed? And I can show you this. At first hour session, I showed graduates, for example, of 2019. This is 65 students, from them 51 passed. This is 78% already. What about other 22? Some of them, of course, not passed. Some of them don't want to be doctors. And this happened each year because some changes in the life happened or something else. Some of them, and this is big amount from this 22%, went to other countries. And they will pass accreditation there. And you can see the graduates of 2021, from 84 graduates, 39 passed. This is 46%. Good amount, good result, which you can show if you will come to our university. Thank you for your attention. If you have any questions, I'm ready for answer on them.
Thank you so much, Professor Anton Olegovich, for such a comprehensive information about the steps that you have taken for overall well-being of Indian students. Sir, we have few questions. Number one, what about the clinical exposure or the clinical practice?
Clinical exposure. On this question, I need to answer from different stage. First of all, clinical exposure and clinical practice you will have on all departments, clinical departments. But this is, of course, depends not only on teacher, it will depend on you. If you want, you will. If you want to go to patient, you will go. If you want to sit in your educational room, you will sit. What problems can tell you sit in the room, for example, and don't go to patient? First of all, of course, you are lazy, for example. But second one, this is afraid to speak on Russian. But Russian is native language of our patients. Yes, our teachers speak on English, but you study Russian, first of all, for work with patients. Because medical profession, this is medical help and medical work with patient, with real human. That's why you need to speak. If you will not afraid to ask him about his clinical symptoms, about his condition, about his case history, and so on. Ask about all examinations that was done, and so on. This is first part. Second one, this is a practice which 1 year ago all students got after courses. It means after third, after fourth, after fifth. For example, practice of medical sister, it's needful. We need to know how to make injections, for example. And We must make them by ourselves, even if we are doctors. Practice of doctor assistant, practice on ambulance in reanimation department, in admission department of hospital, and so on. For example, this is 5th year course. Right now, you know that it's written in recommendations of NMC that internship must be, and right now we have new curriculum in which at 6th year, all this clinical practice you will have full year mostly. During this 6th year, you will be fully in clinics with your clinical preparation, mostly without theoretical work.
Okay. So students, yes, you will get ample amount of clinical exposure. Right from 3rd year, you start going to hospitals for various classes. And coming to the 6th year, you get almost all classes in hospitals with maximum clinical exposure and a little amount of theoretical knowledge also. Apart from that, during your vacations, you have to go for your clinical practical training programs, which can be conducted in Russia, in Russian hospitals, or you can do it in India, in Indian hospitals, where you have to undergo various clinical training programs, which include being a helper of a doctor to the ambulance services also. So yes, you get good clinical exposure. Yes,
and really, I can tell that from 1st year of education, on one subject, this is in simulation center, they will have this nursing department.
Yes.
They can come to clinic with their teacher, but only one thing, they must have sanitary books.
Yes.
With their examination and with stamp of therapeutic that they can come to clinic. They will.
So students from 1st year, you get a subject like simulatory medicine or simulation medicine, where the university has an excellent simulation center, which has life-sized mannequins, robots, which mimic human body, and you are given training about various medical manipulations on those mannequins and robots. And yes, you can go to the clinics with your teacher, but for that you have to have a medical book or a medical, you can say, record, which has to be certified by various doctors regarding your medical tests, and that will be done. That is like our representatives will guide you for that. So yes, ample amount of clinical exposure right from the very 1st year of your education at Orenburg State Medical University. Sir, the second question you have already cleared in the slide. What is the medium of teaching? So from very 1st year to 6th year, the medium of teaching is English for Indian students. So next question, after completing the degree, can we apply for USMLE?
Yes, you can. But you need to tell about this before applying, that our international department must be ready, because for OSMLE, they will ask university, they will send letter to university. University need to fulfill the special form on the side of OSMLE. That's why you need to come to faculty, to my office, to international department, and tell about you want to go through OSMLE. And we need to be ready.
Yes, so students, yes, university is listed in World Directory of Medical Schools, and the degrees that you get, with those degrees, you are eligible to apply for USMLE. But while you are studying, you have to inform the Dean Office that you are planning to apply for USMLE, because there are special forms and documents that the university must fill, or they must send to the USMLE for your registration or for making you eligible for giving the exam. So the next question, do we have separate arrangement for boys and girls in the hostels?
Yes, in hostels we have separate living of boys and girls, and we try to save this. We have rules that boys can come to girls' stages after 10 o'clock and so on. And it will be very good if girls will not come to boys' floors.
Okay,
yes,
so students, yes.
We divide, and we tell about this on our meetings. We tell about this. how to tell, we look on this problem as parents, really. We understand everything, that they're adults and so on, but we really know what parents want. That's why we speak, or we speak openly with students on this question. But dear parents, this question not only in our arms. We separate, they live separately, we look onto this, but this work must be two hands, our hand and your hand too.
Okay, thank you, sir. So yes, students, there are separate arrangements for boys and girls in the university hostels, and there are strict rules where boy students cannot go on the floors where the girl students live, and we try to inform the same in the various meetings that we conduct with the students. And Professor Anton Olegovich, it is a very bold statement that you have made, that you look after the students not as the dean but as the parent. So like, it is a big responsibility that you have on your shoulders, being a parent of 1300 odd Indian students that are currently studying in your university. And I think I want to not only congratulate you, but thank you for your concern and for the care that you extend to our Indian students who are studying and staying in Orenburg State Medical University. I have two comments from people. Himanshu S. Sir, my sister is already studying in 4th year in Orenburg. It is a very good university. And there is one Shalaka Sawant. My brother pursuing last year in Orenburg, Sumit Sanjay Sawant. I thank you for everything.
Thank you.
So thank you so much, sir. These were all the questions regarding Orenburg State Medical University and the living conditions and the study. I request Air Marshal Dr. Pavan Kapoor, sir, please to congratulate Professor Anton Olegovich and Orenburg State Medical University for the hard work that they have put into shaping the lives of our doctors from India.
Dr. Dinesh, yes, I think always the onus is on me to thank the good work done by Professor Anton and his team. And, dear students, parents, and all the viewers, I can say this with a lot of confidence that they not only convert you into proper, capable, competent doctors, but they make you holistic human beings. And that is what requires a lot of involvement, a lot of commitment. And not only this, it requires a lot of monitoring mechanism to be in place. And therefore, they have to be strict at times. Not at times, maybe many times they have to be more strict than what you feel they should be. But then that is how a university grows. So when you come to Orenburg State Medical University, you can enjoy there, you can study there, you can achieve your dream. But remember one thing, that a parent, if they love you for what you do good, they'll also be very strict with you when you do something wrong. And that is what represents Orenburg State Medical University. All this requires time, effort, energy, and a lot of passion. And you can see Professor Anton has all these things with him. He has energy, he spends time with the students, he has passion for the profession, and he wants you all to become passionate doctors. So thank you, Professor Anton, for being what you are. And we hope and pray that this university will continue to rise in the years to come. Thank you very much.
Thank you. Thank you, Dr. Pavan, for such good words about us. Thank you.
Thank you so much, Professor Anton Olegovich, for joining us today and giving a brief about the facilities that you provide in Orenburg State Medical University for Indian students, which make this university the top choice for all Indian students to study MBBS in Russia. Thank you very much, Dr. Pavan Kapoor, for being there to guide the team of Rus Education and all the students regarding their future, regarding the career options that are available for studying MBBS in Russia, and in particular in Orenburg State Medical University. And to all the students who are currently preparing for the NEET exam, if you want to take admission or you have any doubts, any questions regarding studying MBBS in Russia in Orenburg State Medical University, do contact us on our student helpline number, which is 1800-833-3338. You can also visit our website, www.ruseducation.in. You can locate the nearest office and you can come for one-to-one counseling to get guidance about the university or in whole about MBBS admissions. If you have any specific questions for the dean or the administration of the university or for RUS Education regarding your admissions, regarding the MBBS or anything else, please write to us in the comment section. Don't forget to subscribe to our channel and don't forget to press the bell icon so that you get notification for our future live sessions and videos. Thank you so much. We wish you all best of luck for your NEET exam. Stay well, stay healthy, study well for your exam.